Hi, I'm Suzanne and I'm one of the registered nurses here at Pacific Center for Plastic Surgery. I'm going to talk to you today about your post-operative instructions for the LiteLift. We're first going to talk about your activity. When you go home today, you're going to rest. And it's important every couple of hours that you wiggle your toes. You don't need to wake up in the middle of the night and get up and walk around, but we do want you during the daytime hours to get up and move and wiggle your toes and keep that blood circulating. If you have TED hose on, you need to keep those on your feet too for about 14 days after your surgery. Also, it's important to remember that you can't do any heavy lifting or bending. There's no sexual activity for 2 weeks after your procedure, and you also need to not drink alcohol or smoke during the next 2 weeks. Let's talk about position. We talk about sleeping elevated for 2 weeks after surgery. What we're talking about is at least 2 pillows. You don't have to sleep completely straight up, but we do want you to sleep slightly elevated on 2 pillows. It's very comfortable to sleep in a reclining chair or on a big soft couch for the first 24-48 hours. Please remember that when you do sleep elevated that your head tends to turn to one side or the other, so you can use pillows to place either on the right or the left if you tend to sleep on the side, so that you don't tend to roll over and sleep that way. If you do, you can get a lot more swelling on that particular side of your face. Next, we're going to talk about ice. Ice is a really important part of your recovery process. What we recommend is using frozen peas. You can take the frozen peas and separate them in little baggies so that you can rotate them in the freezer. And what you're going to do for the first 48 hours, because the wrap is on your head, is just use that gently on your face to help cool down some of the swelling. Once the wrap comes off, and we'll talk about that in a few minutes, you're going to use the frozen peas then on the areas where the actual incisions are. If you try to use ice over the wrap, it really doesn't penetrate through that dressing. So be sure to use them just on the areas of the skin exposed. You're going to leave the ice on 20 minutes on, 20 minutes off, because your face can be a little bit numb and we don't want you to cause any frozen damage from having the ice on too long. So be sure to use a timer or make sure someone's helping in case you fall asleep. I don't want that ice on your face for a long period of time.